by traffic cops, I'm listening to rainieravenueradio.world.
This is your rainieravenueradio.world community update on the Rally for Reparations, Unity, and Affordable Housing, live on Rainier Avenue Radio, Saturday, July 24th, 2021, noon to 2 p.m. Tune in as the Reverend Robert L. Jeffrey Sr., United Black Clergy, Black Lives Matter Seattle King County, NAACP, Japanese American Citizens League, MLK Jr. committee members, Bethany United Church of Christ, Councilmember Shama Suwant, and many local organizations rally to call for Seattle's political establishment to return land to New Hope Missionary Baptist Church and to fund urgently needed affordable housing. Watch on Rainier Avenue Radio's YouTube, Facebook, Twitch, and find more info on our website. The Rally for Reparations, Unity, and Affordable Housing. Saturday, July 24th, 2021, noon to 2 p.m.
Sunday nights from 9 p.m. to 11 p.m. Pacific Standard Time. It's K-Fox Night Beat with DJ Nastiness.
Bringing back the memories.
Bringing back the memories.
Bringing Seattle's hottest music.
Bringing Seattle's hottest music. rainieravenueradio.world.
You're listening to rainieravenueradio.world. I'm Granville Emerson along with my partner,
Ronald Pepe Bean.
And we host the show Little Line Sports right here on rainieravenueradio.world, where we talk about football, basketball,
Local sports,
national sports, Seahawks,
UW,
Seattle U Redhawks,
Garfield Bulldogs.
all that and more right here on Little Line Sports on rainieravenueradio.world.
You probably have questions about COVID vaccines. Here are some answers about how they're being made.
How are COVID vaccines being produced faster?
Usually, vaccine testing and production are separate steps. But because of the pandemic, vaccines are being developed on parallel tracks. So both steps are happening just at the same time.
How are the vaccines being tested?
Right now, several different COVID vaccines are in testing. Each go through multiple clinical trials with up to thousands of volunteers.
How do vaccines get approved?
Not all COVID vaccine versions will make it to the final stages of testing and approval. Produced vaccines that do not pass clinical trials will be destroyed. But for those that do pass, a team of medical experts will examine test results and possible side effects. If the vaccine is effective and safe, it gets approved and gets to you. Go to covidvaccinewa.org to learn more. A message from the state of Washington.
This is rainieravenueradio.world.
Good morning, Rainier Avenue Radio listeners. We are interrupting the episode of Heartbeat Radio this morning for a special broadcast from Dr. Jeff Duchin, a public officer at Seattle King County Public Health. He'll be letting you know about a recent spike in COVID-19 cases and an update on vaccine distribution. So stay tuned. The doctor has not started his session yet, but when he does, we'll go straight to him. So stay right here on Rainier Avenue Radio. Like, comment, share this video. Dr. Jeff Duchin will be speaking to you and taking your questions shortly.
It's been a few weeks since we've done this, so it's great to see all of you joining here. And just as a reminder, after Dr. Duchin gives his comments, you can raise a question. Make sure to use the raise your hand function, and then I'll be able to call on you. So we'll just wait a few more minutes as folks are joining and that we're going live on Facebook, and then we'll get going. Welcome and good morning. My name is Sharon Bogan. I'm with Public Health Seattle in King County. Thank you all for being here today to hear about what's happening with the COVID-19 pandemic here in King County. As we get started, Dr. Jeff Duchin will have some comments and talk about what we're seeing in the community as well as what's happening with vaccine, and we'll to take some questions from media. So with that, I'd like to turn it over to you, Dr. Duchin.
Thank you, Sharon, and welcome everyone. Today, I'm going to discuss the recent epidemiology and COVID-19 and the increase in our COVID-19 cases that we've been observing, discuss our vaccination rates and related issues, and provide updated recommendations for indoor masking. After about 2 months of decreasing numbers, the trajectory of our COVID-19 outbreak has changed, and cases and hospitalizations in King County are rising. Over the last 7 days, we're reporting 141 new cases daily. The number of new cases has more than doubled in just 3 weeks since June 29th, when the mask directive was lifted. That's a 130% increase. Incidence rates have increased across all age groups, with the sharpest rates increasing among residents under age 49, and the highest rate of new cases among the age groups with the lowest vaccination rates. And I'm sure that's not a surprise to any of us. The 7-day incidence rate is currently 41 per 100,000, which is up from 19 on June 29th. We are in the CDC moderate transmission category and heading towards substantial transmission. Now, incidence rates have been increasing in most regions of the county in the last week, and they continue to be the highest in South and Southeast King County. And over the last month, we've seen an increase in cases in every racial and ethnic group. Currently, the 7-day incidence rate is highest in Native Hawaiian Pacific Islanders, followed by Black and Hispanic residents, and white residents with the lowest incidence rate. Those rates range from 148 per 100,000 for Native Hawaiian Pacific Islanders to 69 per 100,000 for Black residents, 50 per 100,000 for Hispanic residents, and 37 per 100,000 for white residents. However, in the last 2 weeks, we've seen a particularly sharp increase among COVID-19 cases among white residents. Hospitalizations and deaths remain overall relatively low compared to our past peaks, although hospitalizations are increasing. Our hospitalization rate doubled from 1 per 100,000 over 7 days on July 7th to 2 per 100,000 per 7 days on July 17th. And in the last week, 45 COVID-19 cases were admitted to the hospital, representing a new hospitalization about every 4 hours and a 32% increase from the previous week. And as you know, COVID-19 hospitalization rates lag a few weeks behind increases in cases. So we expect to see more hospitalizations as cases rise. And our hospitalization rates are rising the most in our 40 to 69-year-olds, as the oldest adults remain well protected from through vaccination. Very good to report that deaths remain low at 1 new death each day due to the excellent protection our high-risk adults are receiving from vaccination. And this is down from about 10 deaths per day just before we initiated our vaccination program. Now, with the lifting of restrictions on activities, people are doing more while taking fewer precautions. Many people who've tested positive have reported attending social events, out-of-state travel, going to bars and restaurants, etc. And this is not unexpected given the lifting of our restrictions that we would see additional cases. And our recent outbreaks highlight the risk in settings where groups of people have prolonged contact indoors. These outbreaks, like others reported nationally, include settings where unvaccinated people and people with unknown vaccination status were not wearing masks, and instances of infection even in vaccinated people who are engaging in indoor activity in poorly ventilated spaces without masks. I want to talk a bit about the variants of concern in the Delta virus. One of the reasons we're seeing an increase in cases and more concerning outbreaks is the highly contagious Delta variant is increasing and is now the dominant strain of COVID-19 in King County. From test samples collected during the 2-week period ending June 29th, we have genetic sequencing for about 20% of positive cases. And of those, variants of concern were identified in 95%, an increase from 88% 2 weeks earlier. And the Delta variant now represents 56% of sequenced cases in the most recent 14 days, followed by the Alpha variant and the Gamma variant. So when you're exposed to COVID-19 today in King County, it's most likely you're being exposed to the Delta virus. And this is concerning because the Delta variant is so highly contagious. Infected people produce about 1,000 times more virus and are more contagious for that reason, and they're contagious for longer periods. Now, it's important to be clear that our vaccines offer excellent protection against the Delta virus, but the complete series is required. If you want to be protected, and you should, remember it takes 5 or 6 weeks after the first dose for full protection, and both doses of an mRNA vaccine are required. Now, the best news of the day is 80% of residents 12 years of age and older in King County have received at least 1 dose, and nearly 75% of residents 12 years and older have completed their vaccination series. 64% of all King County residents are fully vaccinated. Now, this is a tremendous accomplishment. It makes King County one of the most highly vaccinated regions in the nation and provides substantial protection against severe surges in hospitalizations and deaths from our currently circulating variants. I want to express again huge thank yous to everyone who has been vaccinated. You protect not only yourself, but your family and your community. And equally big thank you again to all of our amazing King County partners, our community organizations, businesses, and healthcare partners, and our public health staff who've been working so hard to make these great vaccination rates happen. Our work is not over. We still have approximately 700,000 King County residents who remain unvaccinated, and a substantial potential to experience a surge from the Delta virus. This includes approximately 390,000 King County residents who are eligible for vaccination and not yet vaccinated, and another 308,000 King County children who are less than 12 years of age who are not currently eligible for vaccination. All of these residents remain at risk for contracting COVID-19. Now, our COVID-19 vaccine completion rates for ages 12 and older vary by age, race, ethnicity, and geography. Our rates are 58% among Black and 59% among Hispanic community members, compared to 69% for white and 83% for American Indian, Alaska Native, and 82% for Hawaiian Pacific Islander, and 85% for Asian Americans. But progress is being made. In the last 2 months, we've seen a 55% increase in the number of residents who identify as Black becoming fully vaccinated, and a 67% increase in Hispanic residents becoming fully vaccinated. So we are continuing to vaccinate, we're continuing to make progress. Although the pace has slowed, we are moving forward, and we would like to move forward as quickly as possible for the sake of all of us. Now, although every region in King County has reached the milestone of at least 70% of residents 12 and older receiving at least 1 dose, vaccination rates continue to lag in South and Southeast King County, the same areas that have had the highest rates of COVID-19 disease. Now, I want to talk for a minute about why vaccination is so important and how our vaccines are working. As more people are vaccinated, we hear more about so-called breakthrough infections being reported among vaccinated people. That's normal and expected because as more people are vaccinated, we know that vaccines are not 100% protective. No vaccines are. So when most people in the community are vaccinated, the only cases that occur, the majority will be among those who are vaccinated. But these COVID-19 vaccines are among the most effective vaccines ever made. And that makes it confusing to hear about cases occurring in vaccinated people. And for that reason, it's important to look at the numbers and understand the real risks of getting COVID-19 for vaccinated versus unvaccinated people. So our EPI team did just that. They analyzed data for a 30-day period from June 9th through July 6th, and here's what we found. About 14% of people who tested positive for COVID-19 were fully vaccinated, compared with 86% who are not. But because the most important thing our vaccines are supposed to do is not prevent mild infection, the so-called breakthroughs are mostly mild, but prevent serious infections, it's most important to know the vast majority of recent COVID-19 hospitalizations and deaths are among people who are not fully vaccinated. Over the past 30 days in King County, 94% of hospitalizations and 94% of deaths due to COVID-19 occurred among people who are not fully vaccinated. And even better, we can compare the COVID-19 risk for vaccinated and unvaccinated people. When we do this, we see that the rate of any COVID-19 infection is 15 times higher among unvaccinated residents compared to vaccinated residents. The rate of hospitalization is 34 times higher among unvaccinated residents compared to vaccinated residents. And the death rate due to COVID-19 is 43 times higher among unvaccinated residents compared to vaccinated residents. So it should be clear from this that the bottom line is that vaccines make it much less likely, but not impossible, that a person will catch and transmit COVID-19, but that they are highly effective at preventing serious illness and hospitalization. And we'll be issuing a more complete report with these data soon and tracking and reporting on these numbers regularly in the future. I also want to speak a little bit about booster doses. The total duration of protection our current vaccines will provide is not known with certainty and could range from many months to years. If the level of protection decreases, a booster dose will likely be recommended in the future, and the CDC and FDA are currently monitoring how well the vaccines protect over time as new COVID-19 variants of concern emerge to understand if or when booster doses may be needed. At this time, protection from 2 doses of mRNA vaccine or 1 dose of Johnson & Johnson continues to be high, and no booster doses are currently recommended. But of particular concern is the issue of high-risk populations like immunocompromised people, some of whom may not develop protection after the recommended vaccination series. And it's likely that a recommendation for additional doses would first come for this group. And I know, because I am a member of the ACIP's COVID-19 vaccine work group and representing the Infectious Diseases Society of America, that the ACIP stands ready to consider and evaluate the safety and effectiveness data and a potential recommendation for additional doses if and when regulatory approval is given from the FDA. That is essential and required. And with respect to administering booster doses here in Washington State, I just want to be clear that Washington Department of Health has advised us that providers administering more than the recommended number of doses, in other words, giving booster doses, are acting outside the scope of the U.S. Food and Drug Administration Emergency Use Authorization and the COVID-19 Vaccine Provider Agreement. So the bottom line is that the vast majority of COVID-19 cases, hospitalizations, and deaths occur in unvaccinated people, and vaccination is the single most important thing you can do to protect yourself and those around you. Now I want to pivot to speak about masks. At our last briefing on July 1st, I reminded that as we move into summer and especially towards fall and winter, we need to keep in mind that there remains uncertainty about the impact of our changing behaviors and increasing activities associated with reopening, about the new variants of concern, about the duration of protection from vaccination, and other things we still don't understand completely about how this virus spreads. And that should the course of the outbreaks change in the future, guidance may also need to change. And earlier, just this morning, I mentioned that about 700,000 people remain unvaccinated and susceptible to COVID-19 in King County. In addition to that number, there are tens of thousands of people with immunocompromise who may not respond to the current vaccination regimen and remain susceptible, and a relatively small number of people who may get breakthrough infections, mostly mild, although some may be able to transmit to others. We also have large numbers of tourists and visitors in our region of unknown vaccination status. What this means is that there are plenty of susceptible people vulnerable to a COVID-19 surge driven by the Delta virus. And although we do not expect a return to the high level of hospitalizations and deaths we've experienced in the past, we could see a surge of preventable illness and hospitalizations. The Delta virus has been a game changer, causing massive outbreaks globally, including among some highly vaccinated countries like Israel and the United Kingdom. On May 13th, when the CDC lifted their mask requirement for vaccinated people, which we subsequently adopted, Delta prevalence was 1.4% in the US. Today in King County, it's at 56% and rising. This is an example of the uncertainty I've referred to so many times with respect to predicting the future course of the pandemic. Today, COVID-19 rates are increasing in King County largely due to the spread of the more contagious Delta and other variants of concern and our changing behaviors, with increasing activities while dropping COVID-19 precautions as the state's Healthy Washington Roadmap to Recovery restrictions were lifted. Higher levels of Delta virus transmission increase the risk for all of us. But we know that wearing a high-quality, well-fitting face mask or respirator is a simple and effective way to reduce risk for individuals and for our community. In fact, I want to call your attention to the most recent report for Washington State from the University of Washington's Institute of Health Metrics and Evaluation, IHME, which finds that if universal masking is implemented in Washington next week, it will prevent between 540 and 880 deaths in Washington State by November 1st. Let me say that again. The University of Washington's Institute for Health Metrics and Evaluation finds that if universal masking is implemented in Washington next week, it will prevent between 540 and 880 deaths in Washington State in the next 15 weeks. And the vast majority of my own infectious disease and public health colleagues are personally wearing masks in indoor public spaces, and they recommend that to their friends and families. And for these reasons, I'm recommending at this time that all people, regardless of vaccination status, once again, voluntarily wear masks in indoor public settings as an extra layer of protection to help us all stay safer, including the unvaccinated adults and the 300,000 children in King County who aren't able to get vaccinated yet, and the many thousands of people who have immune systems that are weakened or suppressed, and to a much lesser extent, vaccinated persons. Now, I know this is frustrating and maybe disappointing to many. It certainly is to me. I did not want to be in this position. And I acknowledge that the changing communication on masking has been a real problem nationally. But we in public health have an obligation to be realistic about the changing situation and provide the best guidance possible. We already require unvaccinated people to wear masks in indoor public settings, although we all know that in stores and other public spaces, there's no practical way to know who's vaccinated and who isn't. And we've all, I think, experienced that there are many venues, public indoor spaces, where most people are not wearing masks. For this reason, universal masking in indoor public spaces provides a more reliable way to ensure everyone is safer for now as we monitor the current increasing disease trends. Masking in public spaces is also beneficial for those who are in close contact with someone at increased risk, to model mask-wearing behavior for children, and to protect from other respiratory illnesses or allergens. This extra layer of protection, intended for settings like grocery stores, restaurants, retail locations, theaters, and entertainment establishments, it's for where we can't be sure everyone's vaccinated, and it helps protect everyone. In addition to masking, I need to stress the importance of improving airflow and ventilation for reducing the risk of COVID-19 indoors. COVID-19 builds up in closed indoor spaces as infected people breathe, and the risk increases where people are singing or shouting or exercising, and with closer contact and with longer exposures. Windows and doors should be opened whenever possible to maximize the movement of air. Building and business owners should evaluate their HVAC systems to increase outside airflow, and upgrade filtration where possible, and consider the need for portable HEPA filtration units. And as always, gathering outside with unvaccinated people is safest. And please remember, if you have symptoms, even mild ones, or you've been exposed to someone with COVID-19, please get a COVID test right away and isolate from others while you wait for your results. With that, I welcome your questions.
Thank you very much, Dr. Duchin. We'll start with our first question from Charlie Harker. Go ahead.
Thank you, Dr. Duchin. And as somebody with a family member undergoing chemo right now, your last comment was rather eye-opening. You're making recommendations today about masking. At what point does it become a mandate again?
Well, I think if we see certainly our healthcare system being threatened, a large number of illnesses and hospitalizations or trending in that direction, I don't think we're going to get there. I think that the level of vaccination that we've achieved in King County will protect us from a severe outbreak that would threaten our healthcare system. On the other hand, I think all of us need to be aware of the risk that the Delta variant poses, that there are many hundreds of thousands of vulnerable people in our community, and there are many opportunities to prevent infections by layering protective measures, vaccination, mask use, ventilation. So at this point, I think we need to rely on the good sense and the voluntary cooperation of King County community members to understand the situation we're in, and that we have a simple, easy, and effective way to add to the protection that we see from vaccination through masking and improving indoor ventilation.
Thank you so much, and we'll go through it. It's like there's several questions, so I'll ask that you start with one, and also to mention your news outlet would be great. So Jessamine McIntyre, go ahead.
Hi, Dr. Duchin. It's good to see you. Thank you for taking my question. You had mentioned that some people were giving, or some providers were giving booster shots without, without obviously being allowed to. Do you know how many of those have been given? I don't know if I want to call it illegally, but how many have been given without approval, and how much of a dent you think that could have made in those vaccinations available to people who want their first and or second dose?
Yeah, thank you, Jessamine. Well, a couple of things. We were not having any supply issues now, so that potential diversion of doses towards people seeking unauthorized vaccination, I don't think would take away from anyone who's seeking vaccination. On the other hand, we really don't have safety and effectiveness data on third doses. So people who do seek that out against authorization are, taking a little bit of a risk, first of all. Second of all, it's not clear that, they need it. And thirdly, they're putting their healthcare provider or vaccine administrator in jeopardy because that person is violating the FDA's emergency use authorization recommendations and provider agreement. But we don't have, a way to know how many people have actually sought out and been successful in getting a third dose or a booster dose. There are studies in progress, and people are interested in a booster dose. I encourage you to look at the University of Washington, where studies are being carried out. But currently, neither the FDA nor the CDC have found evidence that boosters are needed. And again, I think the most likely scenario will be that not boosters for people who are otherwise healthy and been vaccinated, but a third dose in the primary series, perhaps, of mRNA vaccine, or a second dose for those who've received the J&J vaccine if they have a certain type of serious immunocompromising condition, because there are data emerging that suggest that people, for instance, undergoing chemotherapy and who have transplants and who take some very powerful immunosuppressive medications don't respond well at the same level, in the same rate that otherwise healthy people do. And so it's possible that another dose in that primary series will improve their level of protection. And I think that will be the first thing likely addressed. Now, there are studies ongoing. The FDA and the CDC are closely monitoring real-world vaccine effectiveness studies. And we're particularly interested in those people who are vaccinated early on, to look at the duration of protection in some of the older adults and those with underlying health conditions to see if there's evidence that the protection from the vaccination is waning over time or in certain groups. But as of this point, we don't have that evidence. And so for that reason, booster doses are not being recommended currently.
Thank you for the question, Jessamine, and the thorough response. Michael Crow, you can go ahead and ask your question.
Hey, Dr. Duchin, thank you for taking our questions. I guess I was on the ACIP call yesterday talking about booster doses, but I guess you've kind of addressed that. I guess I'm curious if there are, in the way you discussed the warning kind of from Washington, whether there would be penalties is one thing. But moreover, I guess I'm curious about these masks and the fact that it's not a mandate. I mean, in your mind, do we need to see a statewide recommendation that would mirror what you've just recommended of voluntary masking again?
Well, I think that each community needs to look at their disease rates and look at their own assessment of how likely it is that they would achieve compliance with a voluntary mask mandate. The calculus is different across the state. Now, as you know, around the country, more and more communities are making this recommendation. It started with LA County. Multiple counties now in California have recommended indoor masking. Multiple experts in public health and infectious disease have made this recommendation publicly, and more communities across the country are making it because, it just is common sense. Masking is easy. It doesn't cost anything. We're not restricting people's activities or ability to do what they want to do. We're only giving them advice on how to do so more safely. And this whole idea of layered protection is critically important. Vaccines are great. They're highly protective. They're especially against keeping people out of the hospital and dying, but they're not 100%. And with these new variants, as they become more prevalent, they are putting the vaccines through a stress test. And, the more exposures you have, even if you're vaccinated, but particularly if you're unvaccinated, the more activities you do, the less precautions you take, the more likely you'll become infected. Now, if you're vaccinated, the fact is, if you become infected, you're unlikely to become seriously ill, hospitalized, or die. But there's a small chance that you could spread that, you could develop an infection that's unpleasant, but not life-threatening or serious, might keep you out of your activities for a day or two, or you may develop just a mild illness that you don't even recognize, and that's considered a breakthrough. So, these concept of breakthrough really is not really that informative because so many of the infections are so mild, people wouldn't even recognize them as COVID. But the point is that by adding a layer of protection through vaccination and another layer through improving indoor air quality, we can improve upon the total protection that the community sees and the protection of individuals, even those who are vaccinated, but mostly those who are unvaccinated, the children, the adults who have not yet been vaccinated, and the immunosuppressed people in our community who don't respond to vaccine. So, for that reason, many communities are going to recommend this as they experience Delta surges. And again, there's very little downside. We've done it before. We know we can do it. We know it works. It doesn't cost very much. It's easy, and it really works.
Thank you. Tasa, you can go ahead and ask your question.
Hi, Dr. Duchin. Thank you so much for your time. Great to see you again. I'm just, thank you for being honest that this is really frustrating because for people who did their part and got their vaccine or wear their masks, it is kind of disappointing to feel like, we're going backwards. So how do we convince people then to get the vaccines, to protect themselves, to protect their community, to protect their families? Do you think more people will actually get the vaccines once they get the full FDA authorization? We've been hearing a lot of that lately. Or is it just an excuse? Or I don't know how we move forward from this.
Yeah, well, that's a question people are thinking about all over the country. How do we continue to move forward and help those people who are not yet vaccinated make the best decision for themselves, their families, their communities? And as I mentioned in my briefing earlier, we are making progress, but the rate of vaccination has slowed here in King County. And we're very gratified that people are continuing to realize the benefits of vaccination and get vaccinated. Of course, I wish more people would do that more quickly, and that would benefit not only themselves, but their loved ones, those they come in contact with, and others, particularly with this Delta surge, which can really rip through the community very quickly and so highly contagious. So I think there are a couple of things. Some people are just slow adopters, and they're coming to understand that COVID is real, if they ever doubted that, and that these vaccines given to so many millions of people are so highly effective in keeping you alive and keeping you out of the hospital, and that they're incredibly safe. They have a tremendous safety record. And so because of that, these vaccines will be fully approved, given the normal biological license by FDA. But their process is so frustratingly slow. We are all impatient. We believe the data are there and that the evidence is in that would allow them to do that sooner than their usual time frame, which can take years. That, I think, will make a difference for some. And that day can't come soon enough. In the interim, I think we just have to try and, again, understand what people's questions are, address those questions, provide good information about the tremendous risk that COVID poses to personal health and to community health, and how effective these vaccines are in avoiding that risk, helping people stay healthy. Now, the idea that we need to use masks again or that we need to use masks again to maximally reduce the risk to everyone shouldn't deter anyone from getting vaccinated. Vaccination, by far and away, as I showed earlier, is the most important thing you can do to keep yourself out of the hospital and lower your risk for dying and getting severe COVID. But no vaccine is ever 100% protective. And when we're seeing an increasing outbreak due to a new variant, and again, these variants may continue to challenge us. We're lucky because our vaccines are right now very effective against these variants that are currently circulating, but it's not impossible that a variant that evades vaccine protection will emerge. So, keeping the mask around as a layered protection, understanding that improving indoor air quality will be a long-term necessary fix for COVID as well as other viral, airborne respiratory diseases. These are all things that we should just get used to. And, whether or not we need masks 6 months from now or a year from now, I think is less likely, but we should always have that option because they're easy to use. They, add to the protection that we get from our vaccines, and they're effective.
Thank you. We have a question from Rainier Avenue Radio. I don't know if that's you, Tony B, or not, but go ahead.
Yes, we do actually have a question from a Rainier Avenue.
Good morning, Dr. Duchin. How are you?
I'm doing well, Tony. How are you?
Under the circumstances, fantastic. This is kind of a follow-up to the question that was just asked, and you mentioned that there were certain groups that were still not getting vaccinated at the same rate as other groups. Do you have information through either survey or research that explains what those barriers are for particular groups being, I'm just going to say, under-vaccinated? And how are you approaching changing that behavior, or are you doing anything to get a different result from those groups if you have that information that will allay those fears, deal with if it's misinformation, and you're saying that people should do their due diligence, but if there are some consistent things among ethnic groups that are preventing them from getting vaccinated, or again, finding this to be a barrier, or reasons that are consistent why groups are choosing not to do this, what are you saying to them? How is that going to change the behavior to increase the vaccination rate among those groups?
Yeah, really important question, Tony. Thank you. The reasons why people don't get vaccinated vary from person to person and community to community. There are some who have been susceptible to the incredible amount of intentional misinformation that's propagated on social media. Things like, the vaccine impairs fertility, or the vaccine contains a microchip, or the vaccine makes it more likely that you're going to become ill. There's lots of people out there who are intentionally spreading falsehoods about vaccine safety, and folks believe that. There are others who are sort of feeling invulnerable, that they're not susceptible and they don't understand why they should take the vaccine, or they don't understand the risk that they may pose to others if they get it, even if they don't develop a severe illness. There are some that have difficulty accessing vaccine because of their personal circumstances, family, work, ability to get to a location, and so on. And there are those who feel, one of the most common things we hear is that people feel like they wouldn't be able to take time off work, or worry about what would happen if they had side effects and had to miss work. So what we have done, and we'd be happy to have our team talk with your audience on Rainier Avenue Radio in more detail about, if you're interested, is we have pivoted our entire vaccination strategy towards trying to address these types of concerns in the community. So we have teams out in the field working with community organizations and with residents to understand, what their concerns are, to answer their individual questions, and to try and meet their needs that will make them most comfortable with getting vaccinated. So, we're putting resources in neighborhoods and communities where we have low vaccination rates, and doing this type of work, doing outreach based on what we hear from the community representatives, their needs are. We're also, what we've heard is that many community members want COVID-19 vaccination in the context of other health needs. They don't just want to be approached about COVID-19 vaccine. So our teams now are working to include not only opportunities for COVID-19 vaccination when we do our outreach, but also health insurance enrollment, information about food assistance, access to cancer and dental screenings, for example. We've heard this from a number of, particularly from our BIPOC communities and low-income communities. And then we're also trying to make access available for young people in schools, which is very convenient, by partnering with school districts and with healthcare providers to be able to administer vaccines in school districts. And to make it more convenient for people, have healthcare providers integrate COVID-19 vaccine access into just routine healthcare delivery, like we're doing at our Kent East Hill Public Health Clinic. So we are also, we know that some people have difficulty accessing vaccine because they're homebound, or have disabilities, and their caretakers have difficulty getting away for vaccination. And we're doing much more specific outreach to these staff to understand, and these people to understand how to deliver vaccine to them, and to the staff to care for them. So those are some of the strategies that we're using. And again, we'll be happy to talk in more detail if it's of interest to you with the crew who are actually doing this work.
Great. Thank you so much, Dr. Duchin. I wanted to share one question from the community via Facebook around your updated recommendations around masks. The question is whether this recommendation, you would think that it would apply to residents in places like apartment complexes or other common areas, or are you really thinking more about our general public spaces and what folks should know about that?
Yeah, we're talking about indoor public. Well, first of all, if anytime you're around other people indoors and you don't know their vaccination status, unless you know they're fully vaccinated, wearing a mask is a good thing to do to reduce your risk. But this recommendation in particular is for public spaces where you don't know what the vaccination status of other people is, and don't know that they're fully vaccinated. And things like retail, grocery stores, government buildings, other businesses and places where members of the public enter freely. But it's not really meant for non-public spaces where entry is controlled, such as businesses or offices or other places of employment, or businesses with limited access or restricted access where vaccination status can be ascertained. So, for an apartment building, if there's an indoor common space where people are gathering and you're not sure what their vaccination status is, it would make sense to mask in that setting.
Great, thank you so much. And I think we have time for one more question from media and then some closing comments. So Steve Kiggins, go ahead and ask your question. Give Steve another moment here. We may have lost Steve, but Steve, if you're able to just jump on in here, I'll give another moment or two. Okay, why don't we turn it back over to you, Dr. Duchin, for any closing comments?
Sure, Sharon, thank you. And again, thank you for everyone for joining. It's a pleasure to do these sessions with you, and I appreciate your helping us get information out to our community. Now, we have made great progress against COVID-19 in King County through increasing vaccination rates, but clearly we have room for improvement. The more of us that are protected through vaccination, the better off we all are, including those who can't be vaccinated. Encourage all eligible unvaccinated people to please get vaccinated as soon as possible. If you have questions that are preventing you from being vaccinated, discuss with your healthcare provider. And you can find lots of information on our public health website and the Washington State Department of Health site. Delta virus presents a significant new threat, but vaccines continue to do a great job at what they are intended to do: prevent serious illness. We have other tools to reduce risk, like indoor masking and improving ventilation. Remember, layered protection is the best protection. Over time, as more are vaccinated or exposed, the threat of COVID-19 will continue to recede. But as we have discussed many times, uncertainty remains, and it will not be a smooth ride, but one with bumps along the road and intermittent setbacks amid overall progress. We have great tools at our disposal to fight COVID-19. The most important are our vaccines. But until we're a bit further down the road and in a safer and more stable place, it makes sense to continue to take advantage of other easy and effective measures to reduce our risk. Wearing a mask in indoor public settings where not everyone is known to be vaccinated is easy and effective and provides an extra layer of protection for all of us as we get back to doing the things we want to do and need to do. I look forward to speaking with you again in a few weeks.
Thank you so much, Dr. Duchin, and thank you to all the media who've attended as well as those in the community who are getting this information, providing information to friends and family. It's so important. It's been such a critical piece along this whole pandemic. So very much appreciate that. We're also planning on having some written information via blog this afternoon that provides some of the information that Dr. Duchin shared about increasing cases and the new mask recommendation. And so continue to follow us on publichealthinsider.com and social media at KC Pub Health. We also have our Spanish language Facebook page, Condado de King, and we'll be having information on that channel as well. So with that, thank you all and have a great afternoon.
Thank you, everybody, for listening to Rainier Avenue Radio, your community radio station. That was Dr. Jeff Duchin of Public Health Seattle King County for an impromptu press briefing. We apologize on the interruption of the airing of Heartbeat Radio. We will be returning to that in just a couple of seconds, but do join us here in 15 minutes as it'll be time to get fit with the one and only Mark Bryant for some Fitness Corner at 11:30. So thank you all from here at Rainier Avenue Radio Studio in Seattle.